Hello everyone. Today I'll be talking about the three separate articles that I've read about the three different body systems. The three body systems chosen were the gastrointestinal, the cardiovascular, and the hepatic or the liver. So the first article I read was entitled Cirrhosis of the Liver, a Risk Factor for the Development of Cholelithiasis in Males. Well, I chose this article because alcoholism is known to be a risk factor for cirrhosis of the liver, and the consumption of alcohol is well promoted, even on national television. This led my interest to study an article that looked at cirrhosis of the liver and its potential health effects. So, the article addressed the importance of cirrhosis of the liver and the development of cholelithiasis, which is also known as gallstones, in both male and female. Cirrhosis of the liver represents a risk factor for development of gallstones primarily in men. There's a higher chance of gallstone development for cirrhotic males than female. Well, an interesting point that I found in the article was the fact that studies found gallstones to be more prevalent in cirrhotic women. It is important to note that another study showed that sonography may fail to quantify the number and size of gallstone, which could explain some of the contradictory findings. The second article I read was entitled Inflammation in Atherosclerosis, a transition from theory to practice. The reason why I chose this article is because atherosclerosis is a type of cardiovascular disease that has killed many people over the years. The article demonstrated the importance of inflammation in atherosclerosis. Inflammation promotes the formation and degradation of plaques, during which certain types of white blood cells carry out specific functions to facilitate an effective immune response to protect the body. Well, an interesting point that I actually see in the article is the fact that inflammation promotes a common link between the risk factors for atherosclerosis. This is interesting because inflammation can be seen not only as a concept, but as an effective tool used in clinical field for therapy and risk assessments. The final article that I read was entitled Eosinophilic Gastroenteritis. I chose this article because gastroenteritis has been a complicated disease for differential diagnosis because it usually produces symptoms similar to many other diseases. The article investigated the diagnosis of eosinophilic gastroenteritis by reviewing the history of 40 patients with eosinophilic gastrointestinal disease. Patients were divided into groups and their symptoms and possible causes were evaluated. An interesting point found from the article was that some patients had eosinophilia but no indication of eosinophilic infiltration of the gut. Other findings show that some patients had eosinophilic gastroenteritis despite the absence of peripheral eosinophilia. This shows a complication in the diagnosis that I was actually talking about before. It is important that one consider eosinophilic gastroenteritis in the diagnosis of unexplained gastrointestinal symptoms despite absence of peripheral eosinophilia.